Jasmine for inviting ASEBP to kick off the webinar series. Just so you know who you're listening to here, I'll introduce myself. Oh, there we are. My name is Kylie McLean, and I work on the Health Promotion Services team here at the Alberta School Employee Benefit Plan, which from here out I will just refer to as ASEBP. I also have my colleague here alongside me.
Hi everyone, my name is Patricia Talent and I'm also a Workplace Wellness Liaison with ASEBP.
So Tricia and I are both Workplace Wellness Liaisons with ASEBP. Tricia is going to provide a few more examples of the work that we do a little bit later, but essentially our role is to promote employee and workplace wellness amongst school jurisdictions across Alberta. So Colleen and Jasmine had reached out to us initially with this great idea about a webinar because they were seeing more requests coming in for funding to promote staff wellness. And that is what our job is. So here we are today. Our goal with this webinar is to provide everyone who's tuned in who works in some capacity or another who promote employee and workplace wellness with information about resources that are available to their school jurisdictions to help them along the road. So some of the resources we're going to speak to are specific to school jurisdictions enrolled with ASEBP. However, many of them are publicly available, so there'll be something here for everybody. So in addition, we'll be sharing information on best practice strategies for promoting a positive workplace culture, combined with what we're observing as to be foundational from school jurisdictions who are already well into the promotion of employee and workplace wellness. So we have a very limited amount of time together over this lunch hour, and thank you for giving your lunch hours to tune in. Our intention is to give a high-level overview of many ideas and strategies that might meet you where you're at. So for sake of time, we're not going to be diving deep into one single tool or resource. So please connect with our team afterwards if you have any questions or are interested to brainstorm how any of these might be tailored to your school jurisdiction. So I'll be chatting for the next little while, and then I'll hand it over to Tricia, who will speak to the what and the how of employee and workplace wellness. So getting us started, I have a challenge for everyone who's tuned in today. Some of you might be already doing this, and it's going to be not a challenge at all. For others, it might be difficult, or you might be unable to participate. So my challenge for you to is close all the other browsers on your computer's desktop, and to put that cell phone that's in front of you, put it out of reach. We have limited time together today, and I encourage you to stay fully engaged. Many times, myself included, are guilty of multitasking with our cell phones, our computers, and tablets, and sometimes this is out of necessity, but often it's just out of habit. So in replacement of your phone, I encourage you to have a paper and pen in hand. We have a diverse audience tuned in, so I'm briefly going to speak to who ASEBP is, just so it makes sense why we're here in this webinar. So ASEBP provides comprehensive and customized health benefits to employer groups in the public K-12 education sector across Alberta. We provide health benefits for 58 out of the 61 school jurisdictions across the province. Every school jurisdiction is a little bit different of the coverage and which employee groups are covered. So the interesting part is that ASEBP is a not-for-profit health and welfare trust, and we're governed by trustees appointed by both the Alberta School Boards Association and the Alberta Teachers Association. ASEBP's benefit plans and services cover the full spectrum of the health journey, from general health, employee and family assistance, disability, and loss of life benefits, among others. So the Health Promotion Services team that Tricia and I are a part of is one small part of the organization. We work to support and promote healthy workplaces, knowing that adults spend most of their waking hours at work, and the workplace is an environment that can support everyone to thrive and have a high quality of life for all employees, no matter their role, no matter their health status. So that's who we are. And we would love to know who's connected online with us today. So Jasmine is very technologically savvy, and she's going to put a poll up here. And just what role would you most identify with? Would you say you're a school staff member, whether that's a teacher, librarian, secretary? Are you the designated site wellness champion, along with being a school staff member? Are you a principal or vice principal? A member of the central office team, so this might include any directors, superintendents, coordinators, Anyone that works out of central office? Or are you one of our external partners who support school communities? So we'll give you another 5 seconds just to acknowledge who you are. Awesome, thank you. So we've got a bit of a spread here. Yeah, a little bit of everyone here. So thank you so much for joining. So we're going to take a half a moment, and in your own thoughts, I want you to think about reflecting on what is your professional expertise. So perhaps you're an expert in, say, physical literacy or physical education. Maybe you're an expert in early childhood development. Maybe you're an administrator who excels in the area of leadership, or you're from central office and your expertise is in human resources. What are your professional expertise and strengths? So just thinking to yourself. So we understand that as educators and staff that work in schools and with school jurisdictions as a whole, everyone possesses a variety of expertise. And we're going to take a guess that very few of you are experts in employee and workplace wellness. However, this is what you're tuned into, and this might be part of your job to promote employee and workplace wellness. So some of you will be fortunate enough to have devoted work time to this. Others of you might have been voluntold and are perhaps doing this work off the side of your desks. So we're here today to share information and resources that will be worth your time to explore further. You are the expert in your own sphere, just as I don't know how to teach in a classroom or run a school division, but Trisha and our team, we do know health promotion and staff and workplace wellness. So we're confident that we have plenty of wisdom and knowledge that can be married together. And we just want you to know that there is support and resources out there, and that you don't have to do this alone. So another question for you, and something that'll be important in the work that you do with school divisions, is to figure out what is your why to promote staff wellness. So I'm sure you've heard it before, to always start with the why. And knowing your why puts meaning and purpose to the effort you and your teammates do put towards anything. So whether it's your why do you put effort into coaching volleyball after school? Or why did you enter your profession in the first place? Or why do you take that time and effort to have staff bonding, potlucks, or parties? So when it comes to having the why to create a healthy, positive workplace culture for staff, everyone's going to have a different motivation and reason, and that's okay. But most of us can summarize it by saying that just as children need to be healthy, safe, engaged, challenged, and supported to perform at their highest ability, so do the employees who are in charge of and tasked with being those healthy, positive, encouraging role models. So this quote here is from the National Association of Chronic Disease Directors, their Guide to Improving School Employee Wellness. And it summarizes it quite well in my perspective. So whether teaching students in the classroom, running the school, maintaining buildings, or providing safe transport, every school employee contributes to a school's mission. However, employees can only give their best when they're feeling their best. Supporting school employee wellness is an important way to communicate that each staff member is respected and valued. So not only that, but not only the employee contributes to a school's mission, but also a school division's mission. And supporting school employee wellness goes across the spectrum for every staff member. So in building that healthy school community, we are all in this together. So as the quote on the previous slide said, every employee group matters, because in some way or another, every employee contributes to that positive school community, regardless if their job is in the classroom, if it's driving the bus, if it is greeting people when they enter the school. So something that I've learned from you, as those that work in classrooms and in the school divisions, is that your actions in front of students and your teachings, whether they're verbal or nonverbal, the students pick up on it and they model it. I've been told that students are like sponges. So we can draw from that experience that they're observing also you as staff and you as colleagues and the workplace. And this emphasizes that every relationship within a district is not in isolation. So the interpersonal relationships between senior leadership through to administrators and between all employees is not only impacting the morale of the workplace, is not only impacting how staff members do their daily work activities, but it's also on display for students. So I had a really interesting conversation with a group of health champions last year, and they had a really insightful perspective when it comes to role modeling. The conversation was that they're role modeling not only what it means to embody taking care of oneself for their students, but they're also showing what it means to be part of a workplace team. That likely for students, school is essentially their first impressions of what a workplace looks like. And there's opportunity for positive role modeling at every level and between every relationship between a school and a jurisdiction as a whole, whether it's not just between staff and students, but also between staff. So in addition to role modeling, there is also a strategic organizational value to having a healthy workplace. So the literature around workplace wellness in schools specifically is limited, however growing. But there is plenty of research showing the benefits of a healthy workplace to organizational outcomes across a diverse number of industries. And this can be translated to that of the education sector. So this graphic here has been adapted from Health and Safety Ontario from their 2011 publication, The Business Case for a Healthy Workplace. So if your why for creating a healthy workplace is because your team wants to have staff doing the best job they can to be those healthy, positive, encouraging role models for students, that isn't necessarily going to happen unless staff are at work at their healthiest and at their best. So as you can see in this graphic, a healthy workplace can help to minimize work-related stress and helps to foster healthy behaviors of individuals. And this has not only an individual impact, but it has an impact on the organization, the workplace as a whole. So with that, we can see there could be increased employee satisfaction and commitment, which is very important for those working in the education sector, as well as decreased absenteeism, turnover, presenteeism. The list goes on. So what are those elements of a positive workplace culture? We can see that there's importance in the why, both organizationally and individually, and as for role modeling. And once we know our why that motivates us, what is that culture that we are striving to maintain? So and maybe you have too, I've heard some pushback in the past from education staff in all roles, whether they are from the transportation department, whether they're administrative assistants or senior leaders. I've heard the argument that my wellness has nothing to do with my employer or the workplace. I've heard that there's no time to be providing staff with resources or giving them the time to take a Zumba class at work. And I think that this is where some misunderstanding lies when it comes to workplace wellness promotion. So when I'm working with a committee or wellness champions for the first time, one of the first questions I facilitate with them is, what does a healthy workplace culture look like, sound like, and feel like to you? The responses I've received are elements that are so much more than just a single Zumba class or a single event or a single program. The elements that I've heard described to me include things like engagement, include things like understanding and compassion, not only for the students, but for colleagues, for having clear communication from all levels of leadership. It's a culture that includes humor and play because adults need it too, not just students. For example, one wellness champion noted that her school had a positive culture not because they were taking a yoga class at noon once a month together, but their culture was that if they saw another staff member having a stressful day, whether that stress was coming from the classroom or that stress was coming from home, it was just common practice to offer to do photocopying or printing for that person. So having those elements of a positive workplace culture, it doesn't mean that everyone reaches out to each other for pure personal support. We're not each other's counselors. But what it means is that each staff member feels supported when they come to work, regardless of any stresses that are occurring before 8 o'clock or after 4 o'clock. Since we're talking about employee and workplace wellness, it's important to get an understanding of how wellness can be defined. So, as everyone would know here, there are many models in the research on the definition of wellness, but this here on the screen is the model that most resonates with our team after we've asked this question to staff across the province during our presentations and workshops. When we've asked the question, what does wellness mean to you? Often we hear that it encompasses every aspect of their life. It is about feeling balanced mentally, emotionally, and physically. So I'm not going to go into details of the 8 dimensions of wellness, but if you're interested, there is a Dimensions of Wellness guide on the Wellness Sandbox under resources, and you can do your own reading there. So just as individuals, each of us have our own personal health and wellness goals. It could be very different from person to person, whether it is to strengthen the social wellness in our life with those relationships, personally and professionally, or it's about finances. It could be anything. So just as individuals are unique, so are populations, and so are workplaces. And your workplace, your school, your division won't necessarily be the exact as someone else. So taking time, reflecting to yourself, what do you think are the dimensions of wellness that are or would be the top priority to promote? So I've observed school divisions who have used this model, and they try to, throughout the year, have communication material, have opportunities, have learning, have peer support that touch on all of these dimensions of wellness at some point or another, to acknowledge that everyone has unique needs and interests. So I'm going to pass the mic over to my colleague Trisha now, and she's going to speak to the steps that are best practice when it comes to workplace wellness promotion, or things that we've seen to be key steps for success from school jurisdictions across Alberta. So some of these your team may already be doing, or may have done in the past, and it's a reminder to get started on it again. And just to remember that no 2 workplaces are identical, and how a workplace starts or maintains a healthy workplace culture is going to look different for each. So just a few things here.
Thank you so much, Kylie, for starting us off and talking about the value of employee and workplace wellness. I think we can all connect to one example of why. The next part of this webinar will focus on some steps you may consider to promote employee and workplace wellness. Something that we know, and Kylie mentioned, is that no 2 school jurisdictions are the same or will take the same approach. When we were preparing for what we were going to talk about today, we looked at what school jurisdictions are doing and looked at best practice in the area of workplace wellness to focus on 3 main areas. So what you'll see on the screen are 3 main topics, including engagement and buy-in, understanding your audience, and taking inventory. This is not an exhaustive list of everything that you can do, but it seemed to be the top hitters of what Kylie and I thought would be most impactful. Another thing I always like to bring up when we're talking about any sort of a approach to workplace wellness is there is no magic answer or single best approach. It's really about finding what's going to work for you and your audience. So now we're going to start off with looking closer at engagement and buy-in, and that will include looking at committees of wellness and wellness champions. Buy-in and engagement are 2 very important steps when developing plans for any workplace wellness initiative. One of the most valuable ways to develop buy-in and staff engagement is by forming committees of wellness. The quote on the slide from Dr. Graham Lowe, who is a workplace wellness expert, states, "One way to involve employees and create a sense of ownership of wellness initiatives is through a broadly representative wellness committee." So there are some things that Kylie and I like to bring out to school divisions when we're looking at creating these types of committees. And they're just some self-reflection questions that you can ask. Do you have senior leadership involved in committee work? There is great value in the actions of the Wellness Committee aligning with the vision, mission, and values of the school jurisdiction. And having that sense of leadership support can only support the buy-in and engagement from staff. Is there a trustee representation or a connection to the work that is happening for the same reasons as we'd want to look at leadership involvement? Do you have all different employee types represented? This could be things like caretakers, transportation staff, administrative assistants, teachers, educational assistants, administrators, senior leadership, and really the list goes on and on. And this is something that's really unique to the education sector, are the very different types of roles that exist under the same organization. And each one of those groups is going to bring a different perspective, and being sure to have representation will lead to supporting achieving buy-in and engagement. There's a great example that I came across of in the last couple of years where there was a situation where there was no broad representation. And this is when a wellness committee was looking at creating a communication plan and it focused on email. When this wellness program came out, they decided to do it by email, and it came out later that the staff in transportation as well as the caretakers didn't actually check their email on a day-to-day basis based on the type of work they were doing. So they really missed the mark in how it was being communicated. Having those groups on the committee can help to form a good communication plan that's going to meet the needs of everyone. Something else that we've also observed when working with school divisions is having, for example, an ATA local representative on the wellness committee. Is that something you have? What about someone representing the other groups of employees, such as transportation staff? Another great thing that our team has observed in working in this area of workplace health promotion is involvement in learning services in any sort of wellness work. Sometimes student wellness and staff wellness are separated. However, we really encourage looking at it as a whole collective, and we see value in the work being done in complement. So anytime there's something happening in student wellness, what could be done to mirror the activities in staff wellness? And if we're looking at staff wellness, how could that translate and involve students? And again, no two school jurisdictions are the same, and they'll structure these types of wellness committees differently. Sometimes there is one committee that has senior leadership representation. Sometimes there is a separate committee called a steering committee that includes that senior leadership representation. So now we're going to look closer to wellness champions. Again, this might be a term that you use differently in your school division, and you don't have to use the term wellness champion for sure. We see health champion, we see mental health champion. There's really a broad range of terms that could be used. So wellness champions are those that are part of the wellness committee. We recommend having someone from every site as part of the committee. They can be that go-to person for staff wellness. They may be the same as the individual identified for student wellness, or they might work alongside that group. And I'm working in one division, for example, where those two groups are starting to meet together to really collaborate on wellness and making it more broad for the whole school community as opposed to just student or just staff. They can also be any role in the school. It could be the principal, it could be the librarian, it could be the caretaker. And ultimately, this role is a strong social support and will bring the powerful voice of employees. They are that link to the site and the voice of the employees, and that's what really can impact engagement and sustainability. We see a lot of different ways that this group meets. Sometimes it's planning division wellness initiatives. Sometimes it's having a guest speaker for their own professional learning. It might be discussing the supports that are already available and ensuring that the wellness champions are well equipped to support that at their sites. Really, the list goes on, and there's no limit to what it could look like. So now we're going to invite you to answer a question in the poll. And we're wondering if you have an identified wellness champion at every site in your school jurisdiction. So it's central office, every school site. It might be a site for transportation services. Depending how you're structured, there's always going to be some differences. So I'm just going to leave that open for another couple of seconds here, and then I'll get Jasmine to close it. All right, so it looks like the vast majority, about 76% have a wellness champion at each site, so that's great. And about 23% right now don't have a wellness champion identified at each site. So now we're going to move on to understanding your audience, which will include assessing needs and assessing readiness. We just finished talking about buy-in and engagement, and that is really a great foundation for the success of any wellness initiative. Something next to consider is having a good understanding of your audience, and the audience is being all employees in all roles across a division. So I have a reflection question for you. Have you ever planned any sort of an initiative and just had lackluster support from staff? Or have you been in a situation where an initiative's been planned, assuming what you want and need, and you weren't really that engaged with it? If you were the one doing the planning, if you could reflect now and say, did I actually ask the needs and interests of the staff that I was working with? This is why it's so key, and this will lead into the idea of engagement and buy-in as well. You want to target what you're doing based on what the staff need and what they're interested in. There's lots of different ways to get this valuable information. Wellness champions, they are connecting with colleagues at their site to see what they're interested and they're getting the feedback that they have on wellness. Again, having representation from all different types of employees will lend the voice. Use your internal expertise. Do you have a psychologist on staff? Even if that psychologist is mainly focused on student wellness, it certainly is a person that could be a great resource to identify needs for staff wellness. It could be other internal resources or information, possibly in other departments. It might be connecting with other departments. So for example, human resources, finance, learning services. We talked about the link between staff and student wellness earlier on and how these can truly complement each other. Maybe there's information from your human resources department on things like absenteeism or information from previous engagement surveys that would be helpful to guide your work. There are also more formal surveys you can do, something like Guarding Minds at Work or an employee interest survey. Maybe it's looking at engagement surveys. We've seen school divisions use these to guide the work that the Wellness Committee is doing. This ensures that efforts meet the needs. Another example might be focus groups. We've seen focus groups happen in a conversational type approach to really get at the heart of the information of what staff are saying they feel and need. It might be looking at external supports. So an example of that is a health profile that the Health Promotion Services team from ASEBP can offer a school division, typically senior leadership. It's based off of aggregate data on drug utilization, and it helps to place a lens on the prevalence of 4 chronic conditions. We also will look at employee family assistance program utilization and compare that to national standards to gain a better understanding of, are staff using the supports that are available, and how does that compare with the education sector across the country? It might be also looking at other external supports outside of ASEBP. Once you have some ideas of things to focus on, before jumping into action planning, we would highly suggest assessing the readiness of your audience. Just a quick question for you. Have you ever been really excited by a new idea that you want to bring back to your workplace? Maybe you went to a conference or sat in on a webinar such as this one today, or any other sort of learning or peer sharing. Have you ever brought that back to your workplace and brought that idea forward and it really didn't go anywhere? How did that make you feel? And I'd venture to guess it was likely disappointed and slightly discouraged. Now, I want you to flip that around and wonder if you've considered that it might not be your idea that was the problem, but the way in which you brought the idea forward didn't meet the readiness of your audience. I think we can all relate to this experience at some point in our careers. And our team has supported school jurisdictions in tailoring their approach to bringing an idea forward using the Idea Readiness Tool, or as I'm going to talk about it from here on out, IRT. This was a tool developed by the Place Research Lab at the University of Alberta with support from ASEBP. It is an evidence-based tool to help get these great new ideas off the ground. It supports the how. So instead of having an idea, jumping immediately into action planning, it can help you to tailor your approach based on the readiness to meet your audience where they're at. Something that we also want to remember, though, is that readiness for a new idea is not static or maintained from idea to idea, and readiness can differ within a big group. So let's say you have a staff group of 100, and you assess that you think they're pretty ready for an idea. The reality is not everyone in that group is going to be in that same place of readiness. A great example of how readiness can change from idea to idea could be that you really want to bring forward an idea for mental health promotion in your workplace. Right now, your workplace is really on board with promoting physical health, but seems a little bit more cautious in the area of mental health. Here's a great example of how you could use the tools and resources from the Idea Readiness tool to support you in bringing an idea around mental health promotion forward that will help to increase your likelihood of success. If you want to find out more about the Idea Readiness tool, you can visit www.ideareadinesstool.com, or we're more than happy to connect with you after the webinar, and Kylie will share our contact information a little bit later. So now we've talked about engagement and buy-in, we've looked at understanding our audience, we're going to move forward into looking at taking inventory and looking at things like partnerships and resources. And these are things that are already available and at your fingertips. If I've learned anything in my experience in healthcare, and that's the field that I come from, as well as the work I've done in health promotion, it's that no one group can do this alone. We all have areas of experience and expertise, and together we can be so much stronger and effective. Something that our team recommends doing is looking at what resources you already have. It might be partners in comprehensive school health. So for example, the partners that we partnered with on the Sandbox that are available to support wellness include Everactive Schools, Alberta Health Services, the Be Fit for Life Network, Apple Schools, Alberta Healthy School Community Wellness Fund, and ASEBP. Beyond looking at partners in comprehensive school health, you could also consider partnerships in the community. Things like local primary care networks, recreation centers, municipalities, libraries, local colleges or universities, or small businesses. The sky's the limit, and really the list can go on and on. I know within our team, we have numerous examples of school jurisdictions using these partnerships to great success. Another sort of inventory you could complete is looking at what you're already doing. We often have a deficit lens and we jump into something new without celebrating the great things that are already happening. How can you maintain what you're already doing? How can you grow what you're already doing? Or maybe you want to take parts of that and redirect it into something new. Another example of a support is the Health Promotion Services team from ASEBP. And this is the team that Kylie and I are a part of. Again, there is no clear-cut program or wellness plan that suits the need of every division in the province. It's going to look different everywhere. Kylie and I are 2 of the 5 workplace wellness liaisons that work with the 58 school jurisdictions across the province who have ASEBP benefits. So our work is mostly done at the division level, so not specifically at the school level, and the reason for that is to help to increase the impact. We're also often connecting with other partners to leverage their knowledge and expertise. When we work with you, we work alongside you and truly meet you where you're at. What you'll see on the slide is a whole spectrum of support that we offer, all the way from assessing your needs, helping you create sustainable plans, developing strategies, implementing strategies, and evaluating your efforts. One of the examples of supports that our team can offer is guiding and linking you with resources. For example, the National Standard of Canada for Psychological Health and Safety in the Workplace. Something that Kylie and I and our other team members have seen across the province fairly consistently is that emotional and social dimensions of wellness tend to be a very high focus for a number of school jurisdictions. As such, our team completed training with the Canadian Mental Health Association, or CMHA, to become CMHA certified psychological health and safety advisors. This means that we can support and translate the standard when we're working with school jurisdictions to help you bring it to life. The standard is evidence-based, it's also Canadian, and offers a number of assessment and evaluation tools. It wasn't developed specifically for the education sector, but it can absolutely be tailored to meet your needs. What you'll see on the slide are the 13 psychosocial factors that are identified in the standard. It can look like a lot to digest all at once, but there are resources to support you through this. So for example, on the bottom right-hand side of the screen, you'll see guardingmindsatwork.ca, and this is a great online resource that can support you in finding out more and using assessment tools. An example of this is a survey that you can use through Guarding Minds at Work that will help you to assess the strengths, the things that you already are doing very well in, and possibly areas of opportunity that you may want to focus your efforts. Kylie and I have seen a number of different school jurisdictions implement this and use those surveys to a great amount of success. There's another example of the standard in action. It doesn't have to be as grandiose as a big project or program, but on the top left corner of the factors, you will see psychological support. One example of psychological support is having an employee and family assistance program that all staff know about and are aware of how to access and what services that are there. So what we're going to spend the next few minutes on is looking at how an employee family assistance program, or EFAP program, lends to staff wellness. Anyone with ASEBP benefits has access to Homewood Health, and Homewood Health is a third-party EFAP provider. If you don't have ASEBP benefits, you may have a different EFAP available in your school jurisdiction. It might have some similarities to Homewood Health, so please ask your employer about your EFAP provider and what they offer. Specifically for Homewood, it is a 24 hours a day, 7 days a week, private and confidential service that can support you and your dependents. It's also available at no additional cost. Homewood Health includes two main streams: counseling services for things such as anxiety, depression, family issues, grief, and Life Smart coaching, which includes anything from financial and legal advice, career coaching, and nutrition counseling. These are not exhaustive options of what's available under Homewood Health, but should get you an idea of how those two streams differ a little bit, but everything that would be under there. Both of these are available over the phone, online, or in person. Another way to access support through your EFAP is through homeweb.ca. This is an online service with articles, podcasts, and courses. Here you'll also find a wide variety of health and wellness topics to support you. There are also specific supports available to anyone who identifies themselves as a leader. There are customized supports through HomeWeb and something called the Key Person Advice Line, which will connect you with a senior level clinician for consultation on situations that might arise in the workplace. So when making this link between an EFAP program and workplace wellness, we like to think, and us as people in general, like to think that the things we do at home don't affect our work lives and vice versa. However, the reality is that these parts of our lives don't exist in silos. Stresses we experience in either part can impact the other. Something that Kylie and I and our team also see is that many individuals are really not aware of the vast supports that are available through their EFAP. And sadly, typically people don't seek out supports until it becomes an absolute necessity and is affecting more areas of their life. The ideal is to use these supports early and to prevent issues from becoming so much of an impact that it impacts their performance at work, as well as their personal lives. Finally, another resource that is available to you is the Wellness Sandbox, and you'll see the website on the slide. It's the wellnesssandbox.ca. This site is an interactive website that supports workplace wellness. It was created with the comprehensive school health partners that I spoke about earlier in the slides on partnership. It can serve to connect wellness champions across all school jurisdictions in Alberta and is a place to learn, share, and get inspired. Some examples of supports on the site include a vast array of resources that you can filter using the search functionality. There are weekly blogs written from a number of different individuals who work in comprehensive school health, as well as some school jurisdictions, a forum to connect with others in the province, and even a page of events for professional learning. If you're curious about learning about how to use the Sandbox to support employee and workplace wellness, our team would be happy to work with you to help you share information on the Sandbox. And we'll be sharing our contact information shortly. So now I'm going to pass it back to Kylie to summarize all the things we've talked about today, and she'll finish up our session.
Thank you so much, Tricia. So before I pass it off to Colleen to speak a little bit about the Wellness Fund's funding towards staff wellness, I'm going to do a little bit of a recap here. So we provided a lot of information. So again, some of you might be already doing these things. Some of you may have done it in the past and it's a reminder to get back on it. Or you may have been introduced to a new tool or resource that you're inspired to check out more. So to summarize, we started with encouraging you to start with the why. Establish a clear direction on why a healthy workplace is important for you and your school jurisdiction. Look at defining those elements of what you're trying to achieve with a healthy school culture. And define what wellness means to your group. And to summarize what Tricia said, we encourage you to first work towards fostering engagement and buy-in on the idea of workplace wellness. And get all staff groups and leadership to have well-represented committees and wellness champions. And work with those committees and champions to really understand your audience, including all staff groups. So we understand that in education, you have many competing priorities and that timing can be everything. And that's why it's valuable to assess the needs and the level of readiness of your colleagues and the division as a whole. And finally, take stock of what you got. Review all the resources available to you, including those from within your organization and from those external partners. As I mentioned earlier, everyone has their own expertise and strengths, and the real magic can happen when we work together towards a common goal. So this list, what we did was not exhaustive. There are many different other ways to start or continue going. And I know we have many individuals of many different roles that have tuned in today. So I'm going to end with a quote from author and workplace wellness expert Deborah Connors. And this is from her book, A Better Place to Work, Daily Practices Transform Culture. So whatever your motivation, what's important for you to know is that you have the power to create a better place to work. That's right. You. So if you have any questions about what we talked about this afternoon, or if you'd like to brainstorm with one of the workplace wellness liaisons from ASEBP about how you could apply or tailor any of these tools, resources, ideas to your school jurisdiction, please connect with us through email, and that's at health@asebp.ca. We look forward to reconnecting with you or connecting with you for the first time. We might see you at jurisdiction events in the coming months. You also could catch us at Teachers Convention or some of the Everactive Schools Wellness Symposiums there. As well as in May, we will be co-facilitating a pre-conference workshop with Alberta Health Services at HPEC in Red Deer. And here's our list of references. If you have any questions or how to access any of the tools we talked about, please let us know and we can connect you or share this list with you through email. And finally, thank you so much to Colleen and Jasmine for inviting us today and this opportunity to partner.
Well, thank you, Kylie and Patricia, for the presentation. It is so great to hear about all the support you offer to school communities, as well as hearing the familiar words relating to comprehensive school health, role modeling, and wellness committees. Just as a reminder, the Alberta Healthy School Community Wellness Fund receives funding from the Alberta Health to provide facilitated support and grants to school jurisdictions using a comprehensive school health framework. Comprehensive school health is a framework for student health and learning outcomes, which supports the development of healthy school communities. And a healthy school community includes student, school staff, families, and other community stakeholders. Therefore, encouraging school staff to embrace wellness can help build the capacity necessary for them to be effective wellness role models in the classroom. When everyone sees the value in wellness, their own wellness and the wellness of students and peers, it becomes part of the everyday processes and ultimately improves student health and academic outcomes. Improved school climates and positive social environments are then realized for all members of the school community. So many jurisdiction wellness initiatives have indicated that staff wellness is a priority. So while our funding is intended to support student wellness and academic outcomes, we also recognize that staff wellness plays a vital role in the overall climate of the school community. With that in mind, our funding can be used to support staff wellness initiatives such as professional learning and evidence-based resources. So this is intended to bring value to the classroom. So if you think of it in a way of what you're going to be doing for the professional learning or resources, will it equip the school staff with new skills and strategies? Will it provide information that can be shared back to the school community? Will it give you actions that create stronger relationships with the students and increase the overall collective impact of the staff? We believe when staff can be the best version of themselves, they role model wellness, which has a direct impact on students. So with that, we would like to extend our gratitude to all of you for your attendance and participation. We sincerely hope you gained valuable information today. Please do not hesitate to contact with either the Alberta Healthy School Community Wellness Fund or ASEBP should you have any questions about the webinar. Thank you again, and we hope you have a lovely week. And if you can please participate in the 3 evaluation questions that will be shown shortly, that would really help us out, as being that this is just our first webinar. We are here to learn from you as well. Thank you so much.